Hello, Needham Town Meeting members. I'm Sandy Fenwick, the CEO of Boston Children's Hospital, and I want to extend my sincere thanks and appreciation for letting Boston Children's have the opportunity to present our zoning amendment to you for our proposed new satellite facility in Needham. I hope this virtual presentation is informative and gets you excited as much as we are about the possibilities ahead for how Boston Children's can provide valuable benefits to the children and families of Needham, as well as to surrounding communities. While it may seem a bit strange to be planning a new facility at this time, one of Boston Children's strengths is our ability to plan for the long term. It's inherent with working with children, where you hope to deliver care that impacts their entire lifetimes. For more than 150 years, Boston Children's has focused on advancing pediatric care. As the #1 children's hospital in the country, this is what drives us every day. We are committed to providing the highest quality care in the most convenient locations for our families and our patients. Our proposed new satellite facility would deliver this care close to home. The potential location in Needham would provide pediatric specialty care, including orthopedics, gastroenterology, ophthalmology, and imaging, and serve as the location for a new pediatric ambulatory care facility. We expect to provide care to patients in Needham and the surrounding local communities, as well as from across Massachusetts and beyond. We are also committed to being a strong community partner. A new Boston Children's facility will provide substantial benefits to the children and families of Needham through valuable partners and partnerships with Needham Public Schools and youth-focused organizations. We are excited about the potential to become part of the Needham community, and we hope to have your support. I would now like to turn the presentation over to Tim Sullivan, a director with the law firm of Goulston and Storrs. Tim is also a Needham resident and has been our outside counsel on this development project. He will walk you through the proposed zoning amendment. So thank you again for your time, and please stay happy, healthy, and safe during this most unprecedented time.
Thank you, Sandy. And thank you, town meeting members, for taking the time to review this presentation in advance of the meeting. There's 4 topics I'd like to discuss. First, the proposed zoning amendment. Second, the parking and the trip generation review that's been conducted in advance of town meeting. Third, the agreements between the town and Children's regarding payments of taxes. And finally, the additional economic and community benefits we see from development of this site. First, the zoning amendment. Shown on this slide here is the New England Business Center. It's the zoning district in which we're proposing the zoning amendment. I'm sure many people are familiar, but as you know, 128 is on the left, Highland Avenue is on the top of the screen, the Charles River and the town line between Newton and Needham is on the right, and Kendrick Street is on the bottom. So this is the district in which we're proposing the amendment. The text of the amendment is set forth in Article 19 of the Town Meeting Warrant. It really breaks down into 3 parts. First, we're defining a pediatric hospital. Second, we're creating a new pediatric medical facility use allowed only by special permit and only in the New England Business Center. And this use must be owned, operated, or managed by a newly defined pediatric hospital. And finally, we're establish a parking requirement of 1 space per 290 square feet of floor area for the newly allowed use. So Article 19 defines pediatric hospital. It creates a new pediatric medical facility use to be owned, operated, or managed by a pediatric hospital. It is not itself a pediatric hospital. It doesn't have any emergency room or overnight beds. And then we establish a parking standard. Leading up to town meeting, we've worked with the planning board to conduct a parking and trip generation review of the impacts that we would see of development at this site. It's important in the context of this review to understand the site that we're talking about. If this zoning is approved, Children's would proceed forward with a pediatric medical facility at the Center 128 West site. It's a site that's shown here, outlined in aqua, within the New England Business Center. The approved site plan is shown here. The site has been approved for 4 office buildings, 2 parking structures, and a hotel. In this slide here, in gray, you see one of the office buildings, one of the parking structures, and the hotel in gray. These have been constructed. The 3 solid red boxes are the 3 development parcels that have been approved for office but have not yet been constructed. And the hashed red area is the second garage that has been approved but not constructed. If the zoning is approved, Children's would construct a pediatric medical facility at 380 First Avenue. The special permit would remain the same with respect to A Street and B Street. They would be office buildings, and there's no immediate plans to move forward with those. The Garage A would be constructed along with the pediatric medical facility to provide appropriate parking. This context is important because the parking and the trip generation were reviewed as if the entire development were to move forward, even though the only immediate plan is to move forward to the pediatric medical facility. So first, let's talk about parking. As I noted earlier, we're proposing a parking standard of 1 space per 290 square feet, or 3.45 spaces per 1,000 square feet. In connection with our review, VHB, the traffic consultant for Children's, prepared a comprehensive memo regarding the standard. They looked at comparable pediatric ambulatory centers within the Children's network and also within peer institutions, both locally and nationally, that they work with. The memo found that the parking standard that we're proposing is more conservative, requires slightly more parking than both other children's facilities or other peer institutions facilities. The town engaged Beta Group Inc. As a peer review consultant, and they reviewed VHB's memo and concluded that the information was accurate and that the ratio is acceptable. So we're proposing a ratio that has been peer reviewed by Beta and concluding it's acceptable. The second thing that we worked on was trip generation. We looked at the baseline traffic that was approved for the Founders Park, which is 128 West, as well as the adjacent 128 East and the 2nd Avenue residences. And VHB looked at, if you had that traffic as a baseline, and at 380 First Avenue, you built a pediatric medical facility instead of an office building, what would the impact be? And what they concluded was the AM peak hour would be roughly the same, and the PM peak hour would be slightly higher. Now, again, that's assuming that the entire 128 West Center would be developed, but Children's plan is only to move forward with a pediatric medical facility at 380 First. Again, Beta reviewed this information as a peer review consultant on behalf of the town and concluded that VHB's information was accurate. In addition to the time spent on the traffic and parking information, we've also spent time working on agreements with the town regarding payments to be made to the town in lieu of taxes. As many of you may know, Boston Children's, for a facility of this nature, is exempt from paying real estate and personal property taxes. However, it was very clear to us at the beginning that the town wanted to make sure that if we move forward with the development here, they receive the same revenues they would have received if an office building moved forward. So the first agreement we have finalized with the town is an agreement regarding payment in lieu of taxes. Under that agreement, Children's will make an annual payment to the town in an amount equal to what the town would have otherwise received in property taxes for an office use. That amount's adjusted based on the percentage increase or decrease in the overall tax levy, and it can increase by up to 4% a year. The agreement's effective upon the issuance of a building permit, and during the construction period, as is any construction project, the amount that would be due would be the amount equal to the percentage of completion of construction at the time the payment is due. the full pilot amount, commences upon the issuance of a certificate of occupancy. In addition, on the vacant parcels, Children's would be paying taxes in the town's usual manner, and pilot payments would be required on these sites if and when the development proceeds. The second agreement is a host community agreement. Under this agreement, Children's is agreeing to make annual payments in support of youth services in the town in lieu of personal property taxes. They're agreeing to make a payment in the amount of $200,000 annually, commencing on certificate of occupancy, and they're going to make two payments up front, $200,000 upon issuance of a building permit and $200,000 upon reaching 50% completion of construction. In addition to the payments required under the agreements, there's also significant economic and community benefits for development of a pediatric medical facility at this site in the New England Business Center. First, development will move forward on a site that's been approved for development but hasn't moved forward. And that development will be a world-class medical facility located right here in Needham. It would be an innovation hub for Boston Children's clinical research and education. And it's an employer that already employs more than 250 Needham residents, including 50 physicians. And equally as important, it's a use that's going to drive the uses around it. A facility of this nature attracts people locally, regionally, nationally, and internationally. So people will come and they'll eat at the restaurants and they'll stay at the hotels. And in fact, people will stay before their visit. They may stay after their visit for an extended period of time, even to complete physical rehabilitation. And Children's has a strong record of being an engaged corporate citizen in the towns it's already operating in. Children's actually engaged an outside consultant, Trip Bombach, to try to quantify some of these additional economic impacts. And what's shown here on this slide is during the construction period, Trip Bombach expects about $130 million of economic impact, about 680 jobs. And during annual operations, about $52 million of increased economic activity, 28 million in direct impacts and 24 in indirect impacts. And 455 jobs supported or sustained locally during annual operations. 200 direct jobs such as doctors, nurses, staff support, and 255 indirect jobs. In summary, Article 19 is a zoning amendment to allow a pediatric medical facility use in the New England Business Center. This use will provide significant annual revenues to the town by way of payments in lieu of taxes and significant additional economic and community benefits consistent with the New England Business Center goals. We thank you for your time, and we request that town meetings approve Article 19.